40,000 people in West Virginia and Ohio were living with cystic fibrosis in 2023. That is according to the Cystic Fibrosis Foundation. The foundation says 40,000 people across the country have reported having the disease. This Friday, the battle against cystic fibrosis will hold its annual football game to help raise awareness. This disease is a genetic disorder affecting different organs. Our Megan Marshall talked to a pulmonologist at WVU Medicine Camden Clark to learn more about what cystic fibrosis is and how it affects a patient's day-to-day life.
Cystic fibrosis is a genetic life-threatening disease without a cure. There are nearly 40,000 people in the United States and over 100,000 people worldwide with the disease, according to the Cystic Fibrosis Foundation.
The cystic fibrosis deranged gene is called the CFTR gene.
Pulmonologist Roshan Matthew with WVU Medicine's Camden Clark says the gene is responsible for making a protein that helps make mucus semi-fluid. Matthew says without this gene working properly, the mucus builds up and can infect various organs.
You have an infection because you can't clear mucus, you can't clear secretions. It affects a lot of organs, and most importantly, the common things that you see is related to the lung and the sinuses. You have frequent infections with bronchitis, and eventually you have what we call is bronchiectasis. What that is permanent damage of the airways.
Matthew says cystic fibrosis also impacts the pancreas, which leads to malnourishment.
You have cystic fibrosis involving your pancreas, and what that happens is then you don't produce enough enzymes and you don't absorb fat, vitamins and other nutrients that is necessary for you to grow.
Cystic fibrosis has a range of symptoms in addition to repeat lung infections and malnourishment. Matthew says this disease is diagnosed differently for children and adults.
If you have a family history of having the disease itself, then usually you will get screened for it as a child or infant. If it's in adults, usually you send out something called a sweat chloride test. But again, that has to be confirmed with genetic testing.
Matthew says there is no cure for cystic fibrosis.
We have some therapies in medical science to try to control the symptoms related to it, but there's no permanent cure for it.
Matthew says treatments are broken up into 3 sections.
One is to clear secretions from the lung using what we call bronchodilators, or treatments to help open your lung up more so that you can clear these secretions early. The second thing is to treat you during infections with antibiotics, steroids, and all these things. Third thing is really to use something called CFTR modulators to help replace the protein that is deranged because of the cystic fibrosis gene.
If everything fails, Matthew says CF patients end up getting a lung transplant. Matthew says cystic fibrosis doesn't just impact a person's physical body, but also their day-to-day life.
You have to think twice before going to any functions, because you might catch a cold or some kind of infection, and then once you catch an infection to your lung, then you'll have to be admitted in the hospital.